Welcome back to the deep dive. Today, our mission is to unpack a pretty massive stack of medical guidelines, physical therapy manuals, and some really raw patient
Yeah,
anecdotes.
it's a lot of material to get through.
It is, but we are doing it to answer this highly specific, but honestly incredibly common question for you all, which is, can an episiotomy actually affect tightness at the vaginal opening?
Right, which is a topic that I think really demands this kind of close attention.
Oh, totally. Because there's this inherent paradox in the sources we looked at. Like, if you ask most people what to expect after childbirth, the big concern is almost always vaginal laxity, right? Like looseness.
Exactly, that's the cultural expectation.
Right. But then you look at the medical literature and you read these patient stories, and they reveal that episiotomies often lead to the exact opposite problem.
Yeah, a really painful, highly restrictive tightness right at the vaginal opening.
Right. So before we get into the weeds, let's just set the stage here. What exactly are we talking about when we say episiotomy?
Well, simply put, an episiotomy is a surgical cut. A doctor makes an incision in the perineum, which is that area of tissue between the vagina and the anus, to intentionally enlarge the opening for childbirth.
Just a straight surgical cut with a scalpel.
Exactly. And our goal today is to really explore this whole chain reaction, both physical and psychological, because this one single cut can trigger a cascade of events that completely transforms the vaginal anatomy long after the baby is actually born.
Which brings up my first big question. Why would a clean surgical cut cause more tightness and dysfunction than just, a natural tear?
That is the crucial question, and to answer it, we have to look at the history of how this procedure was used.
Yeah, because there's this wild statistic in the sources. Back in 1969, routine episiotomies peaked at like 63% of U.S. births. 63%.
It was incredibly standard practice.
Right, because doctors honestly believed that a straight surgical cut somehow preserved the pelvic floor better than letting nature take its course.
But, let's unpack this. Why did the medical community ever think a scalpel was better than nature?
Well, it comes down to a fundamental misunderstanding of tissue mechanics. The reality is that 40 to 85% of women will tear naturally during a vaginal delivery.
Okay, so tearing is incredibly common.
Very common. But those natural tears are usually shallow. The tissue pulls apart along its natural planes of least resistance, so it generally heals pretty well and pretty easily.
But an episiotomy doesn't do that.
No, not at all. An episiotomy guarantees a deep laceration. You are bypassing the tissue's natural breaking point and slicing straight down into the muscle.
So you're basically forcing a severe trauma on the body.
Exactly. And when you do that, you trigger an entirely different kind of healing response. The body goes into emergency mode. It rushes this protein called collagen into the cut to bridge the gap as fast as possible, which creates scar tissue. Okay, so I was trying to visualize this, and the best analogy I could think of is, well, it's like if you tear a hole in a pair of stretchy yoga pants, right?
Well, I like where this is going.
And instead of repairing it with elastic thread, you just sew a thick, rigid denim patch right over the hole. Like, sure, the hole is closed, but you've completely ruined the stretchiness in that one specific spot.
That is a perfect analogy, because that collagen buildup the body uses to heal a deep cut. It is much firmer, thicker, and significantly less flexible than the healthy tissue around it.
So it's literally a rigid patch.
Exactly. This rigid scar tissue physically restricts the vaginal opening. It creates this very localized, unyielding tightness. The tissue just cannot stretch the way it used to.
Which naturally brings us to the societal side of this, because when we talk about vaginal tightness, there are so many weird, anatomically incorrect myths out there.
Oh, definitely. The misconceptions are everywhere.
Yeah, like there was this one chilling detail in the sources, the so-called husband stitch.
Right. That one is notoriously persistent.
It's horrifying. It's this myth, and sadly, sometimes reality, like we saw in that study from Cambodia, where providers actually believed that adding an extra stitch during the episiotomy repair could make a woman tighter and prettier.
It's incredibly damaging. And if we connect this to the bigger picture of how the anatomy actually works, it's just completely false.
Right, break that down for us, because stitching the opening doesn't actually improve tone, does it?
Not at all. Overall vaginal tone, the actual muscular strength and support, is entirely dependent on the pelvic floor muscles, those deep internal muscles.
So the muscles hold the tension, not the skin.
Exactly. The introitus, which is the physical vaginal opening, is just the entrance. Stitching that opening tighter does absolutely nothing for muscle tone.
It just makes the doorway smaller.
Yes, it merely creates an artificial, completely inflexible bottleneck made of skin and scar tissue, and that almost always leads to pain, not better function.
And just to illustrate how severely scar tissue can alter anatomy, there was that really intense account in the sources regarding female genital mutilation, or FGMC.
Yes, that was a very powerful example of tissue restriction.
Right. The woman in the source described how this sensitive tissue had fused into this incredibly restrictive scar. It caused this constant tugging sensation.
It's a permanent structural barrier.
Yeah, and years later when she was giving birth, that scar tissue completely failed to stretch. It just wouldn't yield, which necessitated a massive episiotomy just to safely deliver the baby.
Which really highlights just how uncompromising scar tissue at the vaginal opening can be. It does not stretch under pressure. It tears, or it acts like a wall.
Wow. Okay, so what does this all mean for the person who is actually living with this scar tissue day to day? Like, functionally, what happens?
Functionally, it often leads to a condition medically known as dyspareunia.
Which means painful sex, right?
Yes, specifically superficial or entry pain. Because you have this inflexible ring of scar tissue, any attempt at penetration, whether that's intercourse using a tampon or even just a standard medical exam, is going to pull on that tight, sensitive tissue.
Because it can't stretch, it just pulls.
Right. And that causes an intense burning or sharp tearing pain.
And we saw exactly that in the sources. There was this really compelling Reddit thread from a mother who is about 10 weeks postpartum.
I remember that one. It's very descriptive.
Yeah, she attempted intimacy with her partner, and she wrote that she physically couldn't do it. She described it as hitting a literal block of scar tissue. The pain was just unbearable.
And that pain is actually the start of a whole secondary problem. Because experiencing that intense pain triggers a psychological and neurological chain reaction.
Wait, really? The brain gets involved?
Oh, completely. When you anticipate the pain of that tight scar tissue being pulled, your central nervous system panics. It sends a signal to the pelvic floor muscles to instinctively clench up and go into spasm to protect the area.
Like a guarding mechanism.
Exactly. This involuntary reflex is called vaginismus.
Okay, so it's like when you're about to get a shot of the doctor and you see the needle, so your whole arm just automatically tenses up. Only this is happening deep in the pelvic floor.
That is exactly what happens. But because the pelvic floor muscles are spasming, it drastically increases the tightness of the vaginal opening.
So you have the physical scar blocking things, and then the muscles lock the door behind it.
Exactly. It creates this vicious cycle. The pain from the scar causes the muscles to tighten, and that tightness causes even more pain the next time you try anything.
That sounds like an absolute nightmare to be stuck in. So how do we get out of it? Like, for the listener who might be dealing with this, how do you actually reverse that tightness once it's there?
Thankfully, there are very clear physical interventions outlined in the physiotherapy guidelines. The most crucial first step is perineal scar massage.
Just massaging the scar tissue, does that really do anything?
It does if you do it right. It's about applying targeted mechanical pressure. Typically, you use a natural oil and your thumb, and you apply firm, sustained pressure in a U-shaped motion right inside the lower half of the vaginal opening.
So you are basically pressing against the rigid scar.
Yes, you are applying a load to it. And over time, that targeted pressure physically breaks down those rigid collagen fibers. It signals the cells to remodel the scar, making it flatter, softer, and much more elastic.
That actually makes a lot of sense. And, bringing it back to that Reddit user's story, she mentioned her doctor actually prescribed her an estrogen cream to use alongside the stretching.
Right, topical estrogen is a fantastic medical tool here.
Yeah, she said it helped thin out that really rigid tissue, and combining that with the stretching allowed her to basically fully recover by 5 months postpartum.
Which is a great timeline. Estrogen plumps up the healthy tissue and increases blood flow, which makes the massage much more effective.
But you also have to address the muscle spasms we talked about.
Right, because the massage only deals with the scar, not the vaginismus.
Exactly. And that is where pelvic floor physical therapy is vital. A specialized PT can teach those hypertense pelvic floor muscles how to finally relax.
Do they use tools for that, or is it just exercises? They often use gradual vaginal dilators. These are smooth cylinders of increasing sizes. By starting with a very small size, the patient can safely stretch the opening while using breathing techniques to calm the nervous system.
Basically proving to the brain that it doesn't need to panic anymore?
Right. It systematically desensitizes the nerves and breaks that mind-body loop of pain.
But what if someone tries all of that, the massage, the estrogen, the PT, and they still hit a wall? Like, what if the scar is just too severe?
In cases where conservative methods fail, surgical revision is usually the next step. Procedures like a Fenton's procedure or an episiotomy scar revision can actually surgically remove that restrictive band of scar tissue.
Wait, they cut it again to fix the cut.
They do, but they reconstruct the anatomy properly this time. They remove the rigid tissue and rearrange the healthy mucosa so that the opening is widened and the elasticity is restored.
Wow. Okay, so synthesizing all of this, it's clear that an episiotomy doesn't just neatly widen the birth canal like a lot of people assume.
No, it was far more complex than that.
Right. The resulting rigid scar tissue, combined with those involuntary pelvic floor muscle spasms, can actually create a highly restrictive, painful tightness at the opening.
But the good news is, as we've seen, it is almost always treatable.
Exactly. With targeted massage, physical therapy, maybe some estrogen, and just giving it time, this tissue can absolutely be
It
rehabilitated.
takes the right approach.
Yeah. And for you listening, whether you are prepping for childbirth yourself, supporting a partner through recovery, or if you're just intensely curious about how the human body works, understanding the mechanics of healing is so important.
It gives you the vocabulary to understand what's happening.
Totally. It empowers you to advocate for better medical care, ask for pelvic floor PT, and honestly just confidently reject harmful myths like the husband stitch.
Absolutely. And as we wrap up, there's one final, really lingering thought from the biopsychosocial research that I think we need to mention.
Oh, please, lay it on us.
Well, we've spent this whole time talking entirely about the physical and muscular causes of this tightness, right? Collagen, nerves, muscle spasms.
Right, the mechanical stuff.
But the research shows that partner support is actually a massive variable in recovery.
Wait, really? Just having a supportive partner physically changes the recovery?
Yes, a lack of emotional support from a partner actually increases what we call pain catastrophization in the brain.
So the brain essentially panics more if you feel unsupported.
Exactly. And that increased anxiety physically intensifies the muscle spasms and the tightness at the vaginal opening. It makes the physical symptoms worse.
That is wild. It really begs the question for all of you listening to ponder how much of our body's physical ability to heal and to just relax is secretly dictated by the emotional environment and the empathy of the people sitting right next to us.
It's a powerful connection to think about.
It really is. Well, that's all we have for today's deep dive. Thanks for exploring the science with us, and we'll catch you next time.